Here are the 5 questions about urinary tract infections USMLE will throw at you, and the last one is the one most students get wrong. Question number 1, they'll give you a young woman with dysuria, frequency, and suprapubic tenderness, but no fever, and they'll ask about what's the treatment. The answer is nitrofurantoin or E. coli. Here is the most common cause of the UTI, and the mechanism they love to test is sexual activity introducing bacteria into the shorter female urethra. Question number 2, they'll give you a woman with high fever and costovertebral angle tenderness, and they'll ask you about what is the management. So this is pyelonephritis, and you manage this with either ciprofloxacin outpatient if this is mild. However, if this is severe, you admit the patient and you need to put the patient on IV ceftriaxone. Question number 3, they'll give you a pregnant woman with bacteria on urine analysis but no symptoms whatsoever, and they'll ask you whether to treat this or not. This is asymptomatic bacteriuria, and in pregnancy the answer is yes, you need to treat it. You need to understand, in pregnancy progesterone slows urethral peristalsis and the uterus compresses the ureters, so untreated bacteria can easily ascend to the kidney, so we need to treat it. In a non-pregnant patient with no symptoms, you don't need to treat asymptomatic bacteria. Question number 4, they'll give you a woman who was treated for a urinary tract infection but her dysuria won't go away, and they'll ask you what to do next. The answer is testing for chlamydia and gonorrhea, because urethritis from these organisms mimics a urinary tract infection perfectly, but it won't respond to the standard urinary tract infection antibiotics. Question number 5, they'll give you a woman with 3 or 4 urinary tract infections a year, and they'll ask you how to prevent these. The answer follows a specific ladder. First step is postcoital voiding. If that fails, the next step is postcoital nitrofurantoin prophylaxis, meaning 1 dose after intercourse. And if that still doesn't work, the answer is daily TMP SMX prophylaxis.